here we go. The thing that always hits me about ACEs-informed or trauma-informed practice or care, it's super complicated, right? It's not just about the people we serve, but it's about us and it's about the systems that some of us work in. Private practice, it's a little more open. But once you get in the health authorities, then, we sometimes struggle with some policy around how we do things, our wait lists, like people like no shows, and we're going to address all that if you're okay. And if you're not okay, the beautiful part about being on a virtual presentation, if we were face to face, you would hesitate to walk out. But the beautiful thing about a virtual presentation, you can just not be there and no one will know, right? It's kind of lovely. So I think what really went on with all this, and it's been slow to take on, like to kind of get rolling, is finally people are recognizing kind of that invisible population, and the idea that we've underestimated for sure in healthcare how many people come from adversity of some type that we're serving. So now, like calling it in healthcare, they kind of term it more trauma-informed care, or you can call it like trauma-informed practice, or you can call it compassionate practice, or even, I know, this is a stretch, like best practice. Like what? What if this is the way we should work with all people, whether you come from adversity or not? And that's the lens that we try to carry. And we understand, like since the beginning of time, whatever your belief system is, that human development has been affected by like chronic life stress because life is challenging. But now we have new research out there, from the neurobiologists who were some of the first doing PET scans of the brain to say, whoa, there looks like there's evidence here that our amazing adults who experience huge adversity when they were little, now their brain responds in a certain way to additional stress. And all of us know that sometimes people coming for an appointment with any healthcare provider is so stressful, right? And there's a lot of fear behind that. So it's just knowing, oh my gosh, we have so much research to draw on. And the epigenetic piece is the latest, right? And all of it will just, it just makes you go, it just makes you stop and wonder, like why we keep doing things the way we've been doing them when we have all this research that says, maybe we should shift. Maybe we should shift. And everyone working in health agencies, like, works with people who have experienced adversity, like all groups. And for dietitians, I can only imagine the number of people you serve where this is like the background piece. And it's affecting how they take in information from you. It's affecting how they respond to the plans that you create for them. Like all this stuff really matters. So this is where we're at, and it makes the medical research around early adversity and later physical presentations is huge, right? As all of you know. And now we're just trying to shift the lens a little bit. It's like, whoa, maybe we can stay away from more limited understanding of certain presentations, right? And start bringing in kind of that broader context of people's lives. And chances are the people that you support, you're not going to know the details of what happened. You don't have to know the details of what happened, because I think, like Amy and I talked at the very beginning, like, you're not counselors. Nobody expects you to be a counselor, but helping practitioners and health practitioners can do so much work in this area through trauma-informed care without being a counselor, right? Because we're not going to put you in that position. You don't want to be in that position just yet. And everybody does the relational piece, like to a greater or lesser extent. So now we're just saying, let's use some of the amazing findings that are out there and shift how we do things just a little bit. And it makes a huge difference. And it's interesting because, like, those core principles that a lot of amazing practitioners already work with, right? What does safety look like in your practice? Like, how safe are you as a person? And when we talk about how safe you are as a person, it's more, can you regulate, right? Are you kind of warm and compassionate, and can you regulate? If you're trustworthy, do you always follow up with your people on what you promised to do? And it's hard, right? In people's busy life because we get kind of overwhelmed. Like, I know I have to take great care as a counselor because I don't know how many emails I get a day. And I'm trying really hard not to lose one. And I'm trying really hard to follow up to the best of my ability. And one of the powerful principles is, like, give people choice. Would this work better for you or this? Because we know that quite often early adversity, what it takes away from people is power and control. So giving people back choice, like just real simple choice, can really start to build the piece around empowerment. And collaboration, like, in I know that working with some people from eating disorders clinics, the counselors that are involved in those clinics, how important that team is. So collaboration in terms of physicians and psychiatrists and dietitians and the counselor, because it takes that type of interdisciplinary practice to really, like, serve people in a way they should be served. So when it moved over to the health authority, then they added a few more pieces, just a few more. You know how it goes. Like, one of the big things is understanding, whoa, this may come out of early adversity. This may come out of traumatic events. The person that you're working with may present as super hyper aroused, and we'll talk about that, or super dissociative, like really shut down. And promoting safety, kind of aligns with the bigger ACEs principles. It's a hard thing to do in a lot of settings, right? Because any healthcare setting can be so triggering. And like we were talking about at the beginning. And what does cultural competence look like, right? What does cultural safety look like? And just for us as practitioners, kind of sitting back and asking, like, questions that are not too invasive, but just to seek a better understanding of, will this information kind of land? Is it culturally relevant? Am I culturally relevant? And what information do I need to be able to do that? And then they're just terming it a little bit different in terms of give people choice. And always sharing the power, like really working with the people we serve to better, like, get them involved in the process. But I think the thing that we're probably going to sit with more today is that a lot of healing happens in relationships. And you're not a counselor. That's not your work. You have this important work over here that counselors do not do. But the ability for you to form attunement with the people you're serving aids in their healing from whatever it is that they've struggled with. It's amazing. And it's really interesting because counselors have to be a little bit humble in this day and age, because we hear more and more stories, and we're more informed now like some of our people from adversity that seek counseling, they will actually talk about the power that a helping practitioner in another discipline had on them. Like recently, I have an amazing person that I'm working with, and one of her most positive interactions in the healthcare setting was with a dietitian, because that person could regulate, that person was compassionate, that person really took the time to figure out how to work with her. And we know now that sometimes it's not the big, long relationships, but it can be a 15-minute appointment, a 20-minute appointment with someone who really connected with them. Isn't that lovely? It's like, whoa, all these trauma informed practitioners are just going to work us counselors out of a job. That's our goal anyway. Like, we live in a world where it's like, if we could just work ourselves out of work, that'd be amazing. It'd also be amazing as a counselor to have people come in and it's like, Linda, I just booked an appointment today to tell you how awesome my life is going. Wouldn't that be amazing? I've had it happen once. I know. It's incredible.